Today we will discuss about irritable bowel syndrome. As you know, syndrome is basically collection or a condition in which many symptoms appear at the same time. So irritable bowel syndrome is the condition of abdominal discomfort, okay, in which there will be pain, maybe like bloating, belching, distension, maybe abdominal cramps. Plus, with these symptoms, there may be like diarrhea or constipation, or maybe this both diarrhea and constipation appear. So this is irritable bowel syndrome, and for this we will give three types of drug, like anti-cholinergic drug, okay, antidepressant drug, and the others drug like symptomatic, that may be diarrhea or like for constipation, like antidiarrheal drug, and for constipation like laxative drugs. So the first is anticholinergic drug, okay, and anticholinergic drug used here as an antispasmodic drug to reduce the pain, to reduce the hypermotility of GIT, and to reduce the contractility, spasm of the smooth muscles. So this drug include like diacyclamine, which is also called as dicyclovirin, another drug hyoscyamine, and alocetrone. These are the drugs that is used as anticholinergic drug. So you know, cholinergic drugs used to work on cholinergic receptors, and cholinergic receptors like muscarinic receptor, and it is present on the smooth muscles of the GIT. So when we give this drug like diacyclamine, it affect on these receptors and inhibit the muscarinic receptor. And when there is inhibition of muscarinic receptor, so this is actually G protein coupled receptors, and it give intracellularly signals to the cells of GIT, like muscle cells. Then it decreases contractility and decrease the spasms in this way. So we have some difference between these drugs, like the diacyclamine and hyoscyamine basically inhibit only acetylcholine dependent receptors, all the receptors which normally activated by acetylcholine. So this drug inhibit those receptors, and alocetrone basically inhibit the 5-HT3 receptors, which is a serotonin dependent receptor. So it inhibit this receptor. And alocetrone basically also given to a woman with IBS having diarrhea, but it can cause severe constipation, and a very severe type of constipation that can hospitalize the patient for surgery. So nowadays it is restricted because it can cause like ischemic colitis and different diseases of GIT that can be chronic. Then we will discuss about anti-diarrheal drug. So you know, diarrhea is basically the rapid movement of stool through GIT. So we will have to decrease this fast movement of stool, and this will be only decrease when we increase the water reabsorption. And for water reabsorption, we should give us more time to the GIT to absorb more water. So let's come to discuss how this time will be increased. So this time will be increased when we decrease the bowel movement. So when bowel movement will be decreased, there will be increased time for availability for fluid and electrolytes in the intestine. How this happen? We have a specific receptors, opioid receptors, and the subclass is mu-opioid receptors, that is basically present on myenteric plexus of the large intestine, and these are basically neuronal plexus, okay. So when we block these receptors, this is a G protein coupled receptors, okay. And you know, when we block these receptors, the cells like smooth muscle cells, cyclic AMP will be decreased, and when there is decrease in the cyclic AMP level of myocyte cells, okay, muscle cells, so the contractility of the muscles will be decreased, and when there is decreased contractility, so the bowel movement will be decreased, and it's basically decrease the movement of longitudinal and circular muscles of the GIT, okay, large intestine. In this way, the bowel movement decreases and increase time for reabsorption of water. And when increase water reabsorption, so the diarrhea will be decreased. Then we will treat constipation. There is different way to treat constipation, but this constipation is with IBS. So there is two important drugs which helpful in IBS for constipation. That is lubiprostone and linaclotide. These are the two drugs which is helpful in IBS constipation. So the first drug, lubiprostone, it is basically act on chloride channel 2 that is present on the epithelial cells of the GIT on the apical surface, okay, and it will helpful in increasing the function of this channel by increasing the chloride rich fluid secretion into the luminal side, and in this way this chloride rich fluid will help in softening the stool. The second is linaclotide. These are the drug which indirectly increase the chloride and increase the motility of the GIT. So these are agonist of guanylate cyclase C. This is the cell cyclic signaling process that increase the chloride secretion as well as increasing the motility of the GIT. So both these two drugs helpful in IBS with constipation. So for the treatment of constipation induced depression, we will use antidepressant drug, and this is tricyclic. This is the drug which is mainly used in IBS for antidepressant drug. So today we have completed this drugs related to IBS. Thanks for your watching.